Hi there, everyone. Welcome to the end of another really busy week. My name is Rendy Murphy. I am an epidemiologist and the Director of Disease Surveillance and Environmental Services at the Mobile County Health Department. Here today to give you an update on the impact of the COVID-19 pandemic on Mobile County. So worldwide, we've seen more than 100 million cases of COVID-19. We're at about 105 million cases. It's just mind-boggling. With nearly 2.3 million deaths worldwide. In Alabama, around 469,000 cases of COVID-19 and around 8,500 deaths. And then in Mobile County today, among Mobile County residents, we added 92 cases yesterday. That brings our total number of COVID cases to 33,917. And remember, we are not yet at 12 months into the COVID pandemic for Mobile County. Our first case was reported on March 19th of 2020. So we're just coming up on our last month or two here, and we have nearly 34,000 cases of COVID. We received reports of 7 additional deaths yesterday. That brought our cumulative number of deaths to 645. And just to remind you that the cases and deaths frequently occur in the past weeks and then are reported to us in the last 24 hours. So the numbers that are added each day sometimes reflect cases and deaths that occurred in prior weeks. But that's the way CDC's been recording them from the beginning, so we'll continue to do that. The cumulative number of people hospitalized with COVID-19 is 4,282. That is an increase of 18 since yesterday. And then the number of people hospitalized with COVID-19 in Mobile County hospitals is down 5 to 191. So again, the number, the case count it is going down slightly. The current hospitalized is going down slightly. We're really excited about that. We still are seeing a fairly high number of deaths, and it will take a little bit of time before we see, the full impact on COVID deaths. That really the seeds were planted, the infections were transmitted way back during the holidays. So again, just want to remind everyone the importance of these community health measures in slowing the spread of COVID so that we, don't overwhelm our hospitals. The hospitals are doing better now, but we are still seeing, and several of them working in surge status. So they've been faring well, but anytime we have a large surge in COVID cases, it negatively impacts our hospitals and our community members, of course, who are more vulnerable to severe illness and death. So please continue to do your part. Get the vaccine when you have an opportunity to. Cover your face with a cloth face covering. Wash your hands. Stay at home if you're sick or if you've been around anyone who's sick so that you don't transmit to others. Disinfect surfaces, all of those things we've been talking about for a very long time now. It's super important that you continue to do this even after you start, if you've gotten a vaccine. We want you to continue wearing your face covering because there are variants of the primary COVID strain that are circulating in Alabama. At least we know of one variant that was detected in 6 people, and only 1 or 2 of those people had traveled out of the state of Alabama. So that tells us that they were infected in Alabama. So we know that these are indications that the variant is going person to person in Alabama now. So, and then there are other types of respiratory viruses that wearing a mask will protect others and protect you. So keep wearing your mask, wash your hands, and the one I forgot, stay 6 feet away from anyone who doesn't live with you. So we got to keep doing those things so that we can continue to curb the transmission of COVID. All right, so talking a little bit about vaccine now. So we're super excited at the health department. This week we had, 3 drive-through events, one in Sims, one in 8 Mile, and one in Citronelle. We had an event planned tomorrow in Mount Vernon, but the weather is not cooperating, and so we are pushing that event to Monday. So on Monday, February the 8th, from 9 to 2, we will be providing first dose Moderna vaccine to everyone who's eligible under the ADPH vaccine rollout plan. So again, Monday, February 8th, 9 to 2, it's in conjunction with our North Mobile Clinic, but it will be held at Belsaw Middle School at 1650 Gartman Circle in Mount Vernon. And remember, starting Monday, all across the state, eligibility includes people 65 and older, first responders, healthcare workers, clergy, state of Alabama, continuity of government strategy positions, courts, correctional constitutional officers, cabinet agency heads, state legislators, and then people who work in corrections, food and agriculture, U.S. Postal Service, manufacturing, grocery store, public transit, education, child care, and judiciary. So you have to show documentation of your eligibility. So bring your driver's license or something else to show your age if you're 65 or older. And if you are in one of these other categories, bring your badge or your business card or maybe a pay stub to demonstrate that you are part of the eligibility. Another very exciting thing in the Get Your Vaccine world, today the Department of Public Health, the Alabama Department of Public Health, announced that as part of a statewide effort to accelerate COVID-19 vaccines in Alabama, mass vaccination clinics will be held in each of the state's 8 health districts next week. So on February 8th, and again, the criteria is the ones that I just read, 65 and older, healthcare first responders, and then frontline essential workers that fall in those categories. This effort in Mobile will be carried out by our hospitals and also by the health department. So in Mobile, the locations are, let me see, so Providence is sponsoring events next week at Dayspring Baptist Church. Check their website. It's appointment only, no walk-ups. You have to have an appointment. So the information on how to get an appointment is available on their website. Mobile Infirmary is providing vaccines next week, again, by appointment only, no walk-ups at Pro Health Fitness Center. USA is providing mass vaccination at the Mobile Civic Center, and this is also by appointment only, no walk-ups, that you can go online to try to get an appointment. And then Spring Hill Medical Center is also having some surge events, some mass events. Also get more information on their website, by appointment only and no walk-ups. It's important to remember that that the hospitals have been planning for this and have been preparing for it, and some of them have very long lists of people who have been on a wait list for vaccine. So now that some extra vaccine is getting in their hands and going to be distributed next week, and the eligibility is opening up, they're filling a lot of those appointments by using the folks that are already on their wait list. So don't get too frustrated if an appointment is not available for you at the place that you want to go, or the time or the date that you want to go. But please go to the sites at these hospitals and complete the online registration when you can, to try to get in queue, so that the next time we have some extra vaccine coming to Alabama, maybe if you don't get vaccinated next week, you can get vaccinated the next time it comes. So again, the state health department is working with the Alabama Hospital Association and all of the county health departments, including Mobile County, and the hospitals and EMA, Emergency Management Agency, to try to push some extra vaccine out into the arms of Alabamians in the most efficient way possible, trying to get thousands and thousands of extra doses in the arms of people next week in just 5 days. So more to come on that. I believe later today, the Mobile County Health Department will be announcing additional opportunities for first dose vaccine in addition to our Mount Vernon clinic, but we are trying to just work that out a little bit. Again, we sometimes find out at the last moment when we may get a little extra vaccine, and we want to have all of our I's dotted and our T's crossed before we announce those locations to you. So again, a very exciting partnership with the Mobile area hospitals, with the health department, with the Hospital Association to try to vaccinate more people than we would normally next week. So that's really exciting news. All right, a couple of questions about vaccine. Let's see. So someone is asking what we do to verify that people actually fit in the eligibility criteria, the eligibility group. And as I mentioned, we check driver's licenses, passports for age, and then we check badges and business cards and other documentation from workplaces to verify eligibility. We do not accept doctor's notes or employer notes that say this person really needs to get a vaccine and is eligible. That does not work. So please keep that in mind. Bring your IDs, your documentation, and have those available when you approach a vaccine clinic. And it sounds like, for all of the hospitals, those are by appointment only, no walk-ups. Okay, let's see something else. Someone asking how the state health department vaccination sites are going to impact the Mobile County health departments. And the answer to that is there's really no impact. We are already obligated based on the first doses that we gave in January. Next week, the Mobile County Health Department is slated to give about 1,800 second doses. And then we will also provide first doses when we have it. So we have enough vaccine to have the clinic on Monday in Mount Vernon. And if we hear today that we are getting more early next week, we will try to schedule some additional opportunities for first dose vaccine next week. So stay tuned to our website at mchdcares.com. That is the location for our vaccine information. So check there frequently, or you can call 251-410-MCHD to hear a recorded message of our locations. Let's see. I get this question a lot. When are people who have underlying medical conditions or disabilities, when will they be able to get vaccine regardless of age? So, people with underlying clinical health conditions of any age are at risk of more severe illness and death from COVID-19, and this is a very important vaccine group. And the state health department will make decisions along with the governor's office, who's receiving information on the allocation of vaccine. They will make that decision when they feel that the current eligibility group has been saturated with vaccine, and or when the state is allocated more vaccine. And stay tuned on that. You may have seen in the news that the Johnson & Johnson vaccine went before FDA late yesterday for review and consideration for emergency use authorization. And that is a single dose vaccine that just needs to be refrigerated. So that could, greatly impact the availability of vaccine. Any questions about COVID? All right. So one last thing, tomorrow there is an opportunity to get your pet vaccinated for rabies at one of our drive-through rabies clinics, low-cost rabies shots for dogs, cats, and ferrets that are good for 1 year. And tomorrow's clinic is from 12:30 to 2:30 at the City of Mobile Animal Shelter. That's at 855 Owens Street in Mobile. The cost is $12, payable in cash, drive-through events. So if you need a 1-year rabies shot for your dog, cat, or ferret, please go to the City of Mobile Animal Shelter tomorrow for that. All right, so that ends our brief for today. As always, we will see you on Monday for the Monday Facebook Live update on the pandemic and COVID vaccination efforts. Have a great weekend, everyone.